And oftentimes parents wonder exactly what do you tell your child and how much do you share with them. So we like to advocate that you do share with them some, at least, about the cancer diagnosis, just done in a very developmentally appropriate way. So many families are nervous because of pre-existing factors like pre-existing emotional concerns that the child might have. Is this something that's going to be too much for my child to handle? If there's another prior association with cancer, if the child knows someone in your family or in your community that has had cancer before or has passed away from cancer, still it's important to talk with these children about what's going on. So we do promote kind of open and honest communication, because children, it's better for the children to learn what's happening from you, because if there's secrecy, the child is still picking up through nonverbal cues and changes in routines that something is going on, and their mind will take them there. And they'll start to feel more nervous and worried if they don't know, if they're not getting a straight answer from the parent, or if the information they're getting from the parent isn't jiving with what's going on at home. So when you're thinking about talking with your child about cancer, give yourself time to prepare. Allow yourself to write down some notes if you want, but you certainly don't have to go off of a script. Figure out who you want to have there with you, whether it's your spouse, another family member, a friend, or someone from the community, or a mental health provider if needed. And then start with the 5 C's. So you do want to use the term cancer. You do want to let them know that they didn't cause it. The child didn't cause it. Nothing that they did or did not do caused it. That it's not contagious. They can't catch it. That's a common belief, especially among younger children. That it's not something that you can control or they can control, or even in many cases that the doctors can control. And also, very importantly, that they can still be a kid, that this doesn't mean that there's no fun. It doesn't mean that they're not going to be participating in other activities. So first, it's important to determine what the child already knows. So they might have some misconceptions about cancer already if they have some associations with cancer. Take time to provide some concrete examples and focus more on specific symptoms. So you do want to alert them to things like hair loss and nausea and things that they might see, or any surgical changes or things that they might see. Parents often, as many people will talk compulsively and quickly and talk a lot when they have something to say that is a little bit more emotion laden. And so it's important to take a break at certain points and allow the child to kind of process and ask their questions. And it's okay to tell your child if they have questions about things that you really don't know about. It's okay to say, I don't know. And it's also okay to get emotional. This is something that is emotional to talk about, and it's okay for them to know that this is hard for you and that you're sad, but it's also important to convey that this is something that you guys will get through as a family. And also, where possible, tell the child what changes they can reasonably expect in terms of their schedule, their routine. Are they going to be spending more time at their grandparents' house or with someone else? Let them know a little bit more, as much as possible, how this will affect their daily routine. And also remember that when you do initiate that conversation about cancer, this is not the be-all, end-all conversation. It's just an opener. This is a conversation that will evolve and continue over time for years. So don't put too much pressure on yourself in that first disclosure. So for preschoolers, it's important to kind of keep the details to a minimum, provide very brief conversations. You don't want to give them a long, hour-long speech about what's going on with you, just very brief conversations followed by repetition. So this is something that you're going to be saying to them, maybe even some key phrases over and over again for them to internalize and understand. Keep it very concrete. So again, focusing on physical symptoms. Where possible, you do want to let them know about hair loss or changes because of surgeries. You can use stuffed animals and dolls to educate them about the location of the tumor. And you can use vocabulary that a preschooler will understand. So you might say something like, I have a boo-boo or an owie in my head that's called a tumor. And again, address any changes to their routine that might be reasonably expected. So for school-age children, it's important to determine what the child already knows, again, particularly if they have some prior association with cancer. Keep the conversations brief, again, with repetition, and give the child time to process. So be prepared that they might go off and play as though they're unaffected, but it takes kids a while to process, and they'll also process, the preschoolers and some of the younger school-age kids will process things through play a lot. So having medical play stuff available to them can be really helpful in helping them to process things. So children during this age can often show their responses through behaviors by being angrier or quieter than usual rather than using words, so you want to pay attention to their behaviors. And older elementary school children may already be familiar with some of the basics of the human body. So if they've already learned about the cells and in their science class or something, you want to take that into account when you're providing information about the cancer diagnosis. And children's books can also be very helpful. So these are two of my favorite, Know Where Hair and When Someone You Love Has Cancer. So when thinking about adolescents, it's especially important to be open with them, because if you don't give them the information they're seeking, they will find it on the internet, and I guarantee you they'll find things that you don't want them to find. So it's really important to keep an open communication and be respectful of their cognitive abilities and knowing that they can understand what's happening in the current moment and can also understand the implications of things down the road. So it's also important to know that teens may go kind of in and out of the situation. They may approach and want to be really involved, and then alternately may distance themselves and seem like they might be even more in denial, but that's just a really common reaction to kind of go in and out of the situation. And they should be encouraged to maintain outside interests and rely on friends and other activities for positive distraction. And it's also important to allow teens to have some autonomy about the situation as well. So whether or not you inform the school, I think, should play a large role in terms of what the teen's preference is and how much the school and their peers and things are informed. So allowing them to also act, if they want to, as the gatekeepers of that information for their social circle. So what to do if you have a child that prefers not to talk? So they may be protecting themselves from unwanted bad news, but the lack of questions and minimal sharing of feelings, of course, can lead parents to worry, are they really understanding this? What can I do to kind of get through to them? But I think taking the lead from the child and paying attention to what they want, so you're providing them with brief information, you're setting the stage for open communication so they can come to you when they want, and you're also allowing them access to other adults or support personnel, such as a mental health provider, that they can open up to, because it may just be that they feel nervous asking or feel worried about how it will be perceived if they ask questions to you about things. On the other side of the coin, you can have the child that is asking just tons and tons and tons of questions, and you feel like you want to try and get their anxiety under control. And so this can be another time when a journal or something can be helpful, just to help them structure and organize their thoughts and worries about certain things. So, but again, I think just maintaining those open lines of communication can help them to feel that they're included, but then also to feel that they're being supported. So the scariest question that parents are often concerned about is that question, am I going to die? And that is a pretty developmentally typical question for kids to ask, even as young as 3 or 4. So just because your child is asking this question does not mean that they're more distressed than they should be. So the important things to address, especially depending on the child's age, is to address what some of the underlying fears might be. So for younger kids, it can be sort of a fear of abandonment, a fear of what will happen to me, and those are things that can be addressed with them. So you can also just acknowledge these feelings and reassure the child that they will be taken care of, that they have ongoing love. And the important thing to do is you don't want to lie to them. You wouldn't want to respond saying, "Mommy will never die," or making a promise that you can't keep. So one way to respond to the question is something like, "Yes, sometimes people die of cancer like Aunt Holly, but my cancer is very different from hers. None of my doctors are worried about me dying, and neither am I. If anything changes, I will let you know." If the cancer is a little bit more advanced, you can say something like, "Yes, people die from my type of cancer, but I'm still really confident that new treatment will help slow down my cancer." So things like that. And then, as things progress, again, you want to keep an open and honest dialogue with them. And so the most important message is to know that this is not something that you have to do alone. You have support of friends and family, healthcare providers if needed, mental health providers if needed. The most important thing is to keep that open dialogue and to encourage the child to talk about their thoughts and feelings going through this process. Accepting the help when you need it from family members, friends, and neighbors, whether that's emotional support for the child or concrete help, getting the child to this practice or that practice, setting up a carpool, setting up help for meals, those types of things. Use your resources as you're able to. And seeking professional support when you feel that it's warranted, but again, hopefully taking away from this talk that there is no kind of ideal way to cope and that there are only a few situations where kids really need to be seen by a mental health professional. And then also seeking out local support groups through your religious organizations or through other cancer organizations, and informing your child's school to the degree that they would like, especially in adolescence. But in younger kids, always a good idea to make sure that the school is aware of what's going on.